Have you ever noticed subtle changes in your elderly loved one and wondered if something more serious might be happening? Maybe they're moving slower than before, eating less, or spending more time alone. Perhaps their mood seems different, or they appear more tired than usual. If this sounds familiar, today's video is especially important for you. We're going to explore the signs your elderly family member may be approaching their final year. The subtle warnings that many people miss, but which can guide you to provide the best care, comfort, and emotional support during this crucial stage of life. Understanding these signs isn't about giving up hope. It's about being prepared, attentive, and compassionate so that every moment you share with your loved one is meaningful and full of dignity. In this video, we'll cover physical signs to watch for, emotional and behavioral changes, medical and health-related signals, practical and emotional preparation for you and your loved one. By the end of this video, you'll have a clear, compassionate roadmap to recognize these subtle signs, understand what they mean, and take thoughtful action. Section 1. Physical signs of declining health. One of the earliest indicators an elderly loved one may be in their final year is physical changes. These changes are often gradual, and while some may seem like normal aging, certain patterns deserve attention. Here are the key physical signs to watch for. 1. Noticeable weight loss. Unintentional weight loss is often one of the first warning signs. This may be due to reduced appetite, difficulty swallowing, or digestive issues. Even a small amount of weight loss in a short period can indicate a decline in health. For example, consider Mrs. Thompson, an 82-year-old woman who always enjoyed her meals. Over the course of a few months, her family noticed she was leaving half of her food uneaten and losing several pounds without trying. This change prompted a medical checkup, revealing underlying health issues that required attention. 2. Decreased mobility. Elderly individuals may begin moving slower or struggling to perform tasks that were once easy. Walking short distances may become exhausting. Climbing stairs may be difficult, or they may start relying on a cane or walker. This decrease in mobility not only reflects physical decline, but can also affect their independence and quality of life. It's important to provide support, but also to monitor if these changes happen rapidly, as it may indicate more serious health concerns. 3. Fatigue and low energy. While occasional tiredness is normal, persistent fatigue that prevents participation in daily activities is a red flag. Your loved one may nap more frequently, decline invitations to social activities, or seem slowed down in ways that weren't typical before. Recognizing these changes early allows you to seek medical advice and adjust their care routine, ensuring they remain comfortable and supported. 4. Physical frailty. Frailty can manifest in multiple ways. Weakness, fragile bones, difficulty rising from chairs, or losing balance. Frailty increases the risk of falls and injuries, which can significantly affect an elderly person's health trajectory. Supporting frailty involves a combination of gentle exercise, nutrition, and safe home environments, but also recognizing when the frailty is progressing faster than expected. Section 2. Emotional and behavioral changes. Physical changes are often easier to notice, but emotional and behavioral signs can be even subtler and just as important. Changes in mood, interest, and social engagement may signal that your loved one is entering a stage where life's end is approaching. 1. Withdrawal from social activities. Your loved one may stop attending social gatherings, visiting friends, or even interacting with family members. While some introversion is normal with age, sudden or prolonged withdrawal may indicate emotional or physical decline. For instance, Mr. Lopez, who always loved gardening with neighbors, suddenly stopped participating and preferred staying alone. His family initially thought it was just a mood change, but they later realized his energy levels had declined and he needed more support. 2. Mood swings and irritability. Changes in temperament, sudden irritability, or increased sensitivity can also be signs of deeper emotional or health issues. These mood swings may be due to physical discomfort, medication side effects, or psychological stress. Recognizing this allows caregivers to respond with patience and empathy rather than frustration, creating a safer and more comfortable environment for the elderly person. 3. Loss of interest in hobbies or daily routines. A loved one who wants to pleasure in hobbies, reading, or watching favorite TV shows may suddenly lose interest. While this can sometimes be a symptom of depression in the context of other physical changes, it may also indicate declining vitality. 4. Signs of depression or anxiety. Depression in older adults is often overlooked because people assume sadness is a normal part of aging. However, prolonged sadness, frequent crying, or expressions of hopelessness should never be ignored. Careful observation, compassionate conversation, and professional support can make a significant difference in their quality of life. Section 3. Health and medical signals. Physical and emotional changes often intersect with health-related signs, which provide the clearest indications that an elderly loved one may be approaching their final year. 1. Frequent illnesses or infections. Recurring colds, urinary tract infections, or other illnesses that take longer to heal are warning signs. A weakened immune system is common with age, but repeated illnesses can indicate a serious underlying decline. 2. Changes in appetite or eating habits. Reduced appetite, difficulty swallowing, or forgetting to eat may not only lead to weight loss, but also signal that the body is losing its resilience. Nutrition becomes critical at this stage. 3. Worsening of chronic conditions. Conditions like diabetes, heart disease, or respiratory issues may worsen despite regular treatment. Pay attention to changes in symptoms, hospital visits, or medication adjustments. Section 4. Preparing emotionally and practically. Recognizing these signs isn't meant to create fear. It's about preparation, both practical and emotional. 1. Open, compassionate conversations. Talk openly with your loved one about their wishes, fears, and hopes. Discuss topics like end-of-life care, living arrangements, and healthcare preferences. 2. Legal and financial planning. Ensure that wills, medical directives, and financial plans are up to date. This reduces stress for both your loved one and the family. 3. Emotional support and connection. Spend quality time together. Share stories, reminisce, and create meaningful experiences. Sometimes, emotional connection is the most valuable support you can offer. 4. Self-care for caregivers. Caring for someone in their final year is emotionally demanding. Seek support groups, therapy, or respite care to maintain your own mental and physical health. Section 5. Advanced physical signs. Beyond the basic physical changes, there are more subtle signs that often indicate your loved one may be approaching the final stages of life. These changes can sometimes be overlooked because they develop gradually. 1. Skin changes. Look for unusual changes in skin tone, texture, or elasticity. Elderly individuals may develop more pronounced bruising, dry or fragile skin, or pressure sores. These changes aren't just cosmetic. They can indicate that the body is becoming more fragile and vulnerable to injury. For example, Mrs. Reynolds, 87, developed small bruises on her arms that were not caused by accidents. Her family initially dismissed them, but her doctor explained that reduced circulation and thinning skin are common in advanced age and signal increased vulnerability. 2. Loss of muscle mass. Muscle wasting or sarcopenia is a common indicator of aging, but rapid or noticeable loss of strength can suggest accelerated decline. This affects balance, posture, and mobility, and can increase the risk of falls. 3. Reduced appetite and hydration. Even if weight seems stable, a decline in fluid intake can be dangerous. Dehydration can cause confusion, dizziness, and organ stress. Ensuring adequate nutrition and hydration becomes increasingly important in this stage of life. 4. Changes in breathing or heart function. Shortness of breath, irregular heartbeat, or swelling in the legs may signal heart or lung issues. Monitoring these signs and seeking medical evaluation promptly can help manage discomfort and prevent crises. Section 6. Emotional and cognitive subtleties. While physical changes are often visible, emotional and cognitive shifts can be more subtle and require careful observation. 1. Increased fatigue in social situations. An elderly person who becomes unusually tired during conversations or gatherings may be struggling with mental or emotional stamina. This fatigue is often linked to declining energy reserves. 2. Forgetfulness and confusion. Mild forgetfulness is normal with age, but sudden lapses in memory, disorientation, or difficulty recognizing familiar places or people can indicate significant cognitive decline. 3. Expressions of fear or anxiety about dying. Some seniors may openly talk about death or express worry about leaving loved ones behind. These conversations are often opportunities to offer reassurance and emotional support. 4. Changes in sleep patterns. Sleeping too much or experiencing restless nights can reflect changes in health or emotional well-being. Sleep disturbances often precede or accompany physical decline. 5. Loss of interest in daily hygiene. A decline in personal care, such as not bathing, grooming, or dressing properly, can indicate fatigue, depression, or cognitive decline. Offering gentle assistance without judgment is key. The importance of compassionate presence. Often, the most profound gift you can offer is your presence. Simply being there, listening, and providing reassurance can significantly improve their emotional and mental well-being. Even if words fail, gentle gestures, a hand on the shoulder, a warm hug, or sitting quietly together communicate love and support. These moments become memories that last long after they're gone. Section 6. Emotional and cognitive subtleties. While physical changes are often visible, emotional and cognitive shifts can be more subtle and require careful observation. 1. Increased fatigue in social situations. An elderly person who becomes unusually tired during conversations or gatherings may be struggling with mental or emotional stamina. This fatigue is often linked to declining energy reserves. 2. Forgetfulness and confusion. Mild forgetfulness is normal with age, but sudden lapses in memory, disorientation, or difficulty recognizing familiar places or people can indicate significant cognitive decline. 3. Expressions of fear or anxiety about dying. Some seniors may openly talk about death or express worry about leaving loved ones behind. These conversations are often opportunities to offer reassurance and emotional support. Section 7. Recognizing medical signals in depth. Medical monitoring is crucial. Some of the most reliable signs an elderly person may be in their final year are found in their health patterns. 1. Frequent hospital visits. Repeated hospitalizations or emergency visits often indicate declining resilience. These visits may result from falls, infections, or exacerbation of chronic illnesses. 2. Decreased response to treatment. If previously manageable conditions stop responding to treatment, it may suggest that the body is losing its ability to heal. This can include slower recovery from infections or reduced tolerance to medications. 3. Changes in vision or hearing. Significant deterioration in sensory functions can increase isolation, frustration, and accidents. Maintaining sensory aids like glasses or hearing devices can improve quality of life. Real-life story for connection. To help illustrate these signs, let's look at a few real-life scenarios. Mrs. Allen, 85, started losing interest in her garden. Initially, her family thought it was normal aging, but combined with weight loss and fatigue, it led them to consult her doctor, who helped manage her chronic heart condition. Mr. Chun, 90, began refusing social visits and spending most of his time alone. His family encouraged storytelling sessions, which rekindled joy and improved his mood significantly. Mrs. Patel, 88, developed recurring infections and frailty. Early recognition of these medical signals allowed her family to arrange palliative care, ensuring comfort and dignity in her remaining months. These stories highlight the importance of attentiveness, compassion, and early action. To help illustrate these signs, let's look at a few real-life scenarios. Mrs. Allen, 85, started losing interest in her garden. Initially, her family thought it was normal aging, but combined with weight loss and fatigue, it led them to consult her doctor, who helped manage her chronic heart condition. Mr. Chun, 90, began refusing social visits and spending most of his time alone. His family encouraged storytelling sessions, which rekindled joy and improved his mood significantly. Mrs. Patel, 88, developed recurring infections and frailty. Early recognition of these medical signals allowed her family to arrange palliative care, ensuring comfort and dignity in her remaining months. These stories highlight the importance of attentiveness, compassion, and early action. Recognizing that an elderly loved one may be approaching their final year is never easy. It comes with a mix of fear, sadness, and sometimes helplessness. But remember, this knowledge empowers you to act with care, love, and mindfulness. Every gentle touch, kind word, and moment of attention counts. By observing the subtle signs, responding with empathy, and preparing practically, you can make this stage of life as meaningful and comfortable as possible for both your loved one and your family. Cherish the time you have together, and remember, love, presence, and understanding are the most powerful gifts you can give.